Hello and welcome to this week's What Were They Thinking? This week's summary of weird, stupid and impressive news includes fears about vaccines and relationships to blood for those who are donating, the possibility that certain beliefs and thoughts, particularly amongst conspiracy theorists and denialists, could lead to unstable groups, to no one's surprise. The increasing number of epidemics that are causing more children to go into hospital and stay there for longer. Evidence that the peer review process does work to some extent, and more importantly, how scientists can keep themselves accountable and by doing so, keep others who are involved in their publications accountable for what has been put into the literature. The timestamps for these and other news items can be found in the description box below. Let's start with concerns in Canada about blood, and specifically, blood from those who have been vaccinated. Oddly enough, this is Canadian news, not American news. You would expect this to be something more democratic and oil-oriented, but no, it comes from the snowy northern sides of Canada. The news circulates all around one basic issue. There is an increasing number of patients who are refusing blood transfusions from donors who have been COVID-19 vaccinated. Yeah, they're refusing blood from individuals who have been vaccinated and, at present, should have little to no antibodies that would have any relevance to them unless they became infected with COVID-19, in which case it would be to their benefit. They are quite literally making their treatment worse for no gain whatsoever. Historically, there have been good reasons to be concerned about blood transfusions. Notably, before HIV became incredibly well known, and donors of blood could be carrying it or infected and then pass on that infection to others. This became a crisis in the 80s, but due to extensive testing and questionnaires before donations happen, the risk of that has plummeted to nearly zero. The second reason why this is particularly dumb is that Canada has a well-developed blood donation and transfusion system. Their blood is incredibly safe, which means those who will be donating and those who are receiving are completely covered from start to end. Yes, historically there have been some exceptions, but they are the exception, not the rule. And so there is very little reason why Canadians would be asking for blood specifically from unvaccinated individuals. The very idea is seemingly derived from various bizarre conspiracy and alternative fact ideas, which are, to be frank, simply another way of saying made-up beliefs. These groups themselves tend to be just as unreliable as the facts they espouse, and this is evidenced this week by one particular group that has denied COVID imploding, and not for good reasons. The leader of this anti-COVID group, who claimed and similar far-reaching and ridiculous claims, was spending extravagantly using the group's money. Yes. Whilst they are the founder, that does not give them carte blanche to be able to spend $3.6 million on a mansion in Florida, $100,000 on a single private jet trip, or $50,000 a month in personal expenses. It gives them cause to claim for reasonable travel, reasonable expenses, and similar. $3.75 million in 1 year alone does not come under that umbrella for any kind of group like this. This has led to the group trying to oust the founding member and take control of the remaining assets in the bank account, about $7 million. The internal collapse of this group is not necessarily a bad thing, as their rank and file members are responsible for trying to organize things that really shouldn't be organized, such as prescriptions for ivermectin and hydroxychloroquine. Both of these have shown little to no evidence that they should be used, and evidence that they shouldn't be used has been plentiful. As a result, the implosion of this group is not a bad thing. This is not the only anti-vaxxer news that should have people rejoicing this week. Another anti-vax doctor, in this case, Paul Norman Thomas, formerly MD, has had their license rescinded by the Medical Licensing Board. The reason it was pulled include unprofessional or dishonorable conduct, making false or misleading statements regarding the efficacy of treatments, repeated negligence and gross negligence in the practice of medicine, willfully violating any provision of this chapter, knowingly making a false statement or representation on a matter, failing to comply with a board request, and failing to report an adverse action. Did we mention that this was a pediatric doctor? Yeah, that's kind of important since all of these complaints regard the mistreatment of 7 children. Yeah, there's a good reason why he's no longer allowed to practice medicine, and you're beginning to see why. But the best part of this is that he voluntarily surrendered his license. That tells you how serious the allegations were. It's a choice between voluntarily rescinding it or having it rescinded on his behalf, which makes it that much harder to get back later on. The full details of just what he got up to or failed to do are likely to get this video heavily restricted by YouTube, so we do suggest reading through the article and seeing just what he did that was so egregious that he has lost his medical license. While still on medical news but shifting across to America, land of the brave free and in this case diseased, especially the children. There is a tripledemic. This is flu, RSV and COVID occurring increasingly in American children, and these children are taking up all available beds in many hospitals, and this is a big problem. Children were thought to be relatively immune to COVID-19. The annual influenza strain hasn't been a concern for the last 2 years as its spread was sequestered and basically completely nullified due to various restrictions. RSV was perhaps the only exception. And now you have all 3 coming back with a vengeance. To draw a comparison, during the peak of COVID-19, there was incredibly tight space limits for patients. They were finding anywhere and everywhere to put them, but most hospitals could keep their patients in rooms or at least within the hospital itself. Some hospitals are now having to look at setting up what they call surge tents. These are literally tents set up by the National Guard in parking lots to care for sick children. The problem is that it's not one disease and it's not one hospital. In fact, it's the 3 diseases together and the fact that it seems to be hitting every major hospital and every county in America and even parts of Canada that is causing this tripledemic to be such a big concern. The reason why the hospitals are struggling is that over the last years, there has been a decrease in the number of pediatric beds. This is because there are fewer children in America. These beds have instead either been closed in the hospitals they're attached to, or converted to adult hospital beds. This was increasingly done so during the peak of COVID-19. Unfortunately, now those beds aren't being turned back into pediatric beds. Secondary to that is that more and more of those same beds are being taken up by adults who have influenza and a particularly nasty strain this year. The confluence and competition between adult needs and children's need in this case is what's creating a problem. There are too few beds, too few facilities, and too many sick individuals. Dealing with individuals once they're sick is all well and good. It's in fact ideal that we do at least have facilities available, even if most of them are near capacity. Better yet, if we can try and stop things from happening before then. This is where cholesterol-lowering medication comes into play. There are 2 kinds of cholesterol that are important for heart disease. Low-density lipoproteins, which are the bad kind, and high-density lipoproteins, which are the good kind. Good diet, good exercise, and the use of statins has been shown to increase the amount of HDL or high-density lipoproteins. On the lower-density lipoproteins, but diet does. This means by using exercise, diet, and medication conjunctively, you see a big improvement in health outcomes. The problem is that there is an increasing push and claims by supplement manufacturers that they can achieve the same sort of thing. There is a distinction between real medicine and fake medicine. Real medicine will work, and supplements do not fall into this category. primarily because they've not been shown to work, and this is the key. The claims that the supplements work would mean two things. One, that they would actually need to look at getting it approved as a drug, which means all the clinical trials and rigmarole of the FDA. Fun times for everybody and incredibly expensive. No supplement manufacturer wants that. On the other hand, if they don't work, but they can find some way to claim it does, they can get the best of both worlds. This is where those supplements are getting in trouble. They're making a lot of claims, but the evidence doesn't back up what they're saying. The journal article from the blog Science-Based Medicine goes into details about how they conducted a study. It involved 190 participants, and they ran various analyses of the data. The primary endpoint was what change was there in low-density lipoproteins from 28 days. That is 28 days of use, and it was, for the most part, none, or at least not enough to be any kind of biologically significant value. And those are the two possible escape routes you could have. Statistically significant, which is the best kind of significant, or it could be biological significance, which isn't as good, but is sometimes used as a way of making a claim without it being statistically significant. The attraction of supplements is not to be denied. It doesn't require prescriptions, it's often significantly cheaper, and it's a lot easier to access. If you could try and get the same results as you would from a prescription medication from a supplement, it makes sense to try. But as the results here show, no, it does not work. On the topic of things that work, we have evolution, or at least natural selection, and in this case, the crossbreeding of brown bears and polar bears. There is an increasing hybridization of the two in the Arctic. A number of studies based in Canada and now Russia have shown that the hybridization of the two appears to be spreading increasingly north, and this would appear to be caused by the increased survivability of the crossbreed versus the pure brown bear or polar bear. Next we have the reliability of peer review, and it's worth remembering that this is peer review, not things like predator publishers and similar, who will, as long as you give them money, put anything on their website and claim it was peer reviewed. We have a video detailing why that is nonsense here. The example we want to draw your attention to this week in particular is about a man called Matthew Schrag. They are a student and went on to some success. They've published a number of articles. For the most part, their articles are good. The problem is that what they've found is that some of their work, and particularly their work associated with one individual supervisor from quite a number of years ago, have all been plagued by problems. The problems are all image related and appear to indicate that the supervisor was doctoring images to try and make claims that were not there. The student has in turn brought this to the attention of two groups. The first is a pair of very good analysts who have identified many dodgy publications and raised concerns about them. The second is actually taking it directly to that supervisor and working with the publications that published those articles to get them retracted. There is one very big problem with what's happened, however, and this, however, needs to be pointed out. The supervisor had all of their work recorded, and they are required to do so. It's part of good lab management and generally a requirement of most universities, funding bodies, and lab practice. They've purged their system of all the records, and importantly, the raw experimental data. This is what would be used to try and figure out if any of the images had been doctored in some way. And by doing so, they have, whilst also admitting to having conducted some very dodgy practices, also removed the ability to prove what they were. The problem with what they've done, other than the moral and ethical element, is that there were a lot of papers, 33, that they suspected were altered in a way that was not okay. It's not an issue if you help to make an image clearer, and so long as you very, very clearly indicate that you have done that in the publication. It is a problem when there is a 67-page dossier which outlines the more than 100 images which may have problems. This whole affair has come to light not because other individuals identified it necessarily, but because one student was willing to bite the hand that fed them by pointing out that their supervisor and mentor engaged in unruly practices that should not have been allowed, thereby bringing the integrity of the literature into disrepute, and by doing so, failed to apply the basic rules that are applicable to any and every researcher. It's not one rule for thee and another for me. Everybody has the same requirements. Going to tech-related news now, and the final news item we have for you this week. It's about Facebook and more of its questionable practices that appear to put money over people, which isn't that surprising. They're a tech company run by a lizard man. Facebook has, for many years now, offered to run advertising so long as you pay them. This is not necessarily terrible. After all, it's a free service, and by doing this, they allow it to stay free. The problem is what they're allowing to be advertised, and in some ways, how they're advertising it. For example, dangerous and in some cases banned supplements are being advertised on social media. Just a small sample of the kind of advertisements that were being presented include things like Comfrey, which is illegal to sell in the United States of America, Kratom, which is a product we've described in the past, and has its own issues, and a reverse diabetes package, which is bullshit. As the blog post summarizes this, an investigative analysis by Consumer Reports found that Facebook is being used to market unapproved and even prohibited supplements. Despite its policies against marketing unsafe products, there appears to be little enforcement of this policy. Yeah, as said, Facebook putting money before people, and in some cases, putting people's lives at risk, given that something like Comfrey can cause liver damage and ultimately death. That's all the news we have for you this week. Thank you for watching. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions that you have below.